online, and I'm so happy to be here again because of the COVID. We were always, communicating online, and I'm very nice to be here in person and meet all of you and to discuss about our findings and receive your comments, recommendations. I will be very happy. It will be very much helpful for our future next research. So I will talk about basically about findings of our background paper on unpaid and paid care work in Mongolia. When we started, we thought it would be not very, but easy. It's not modeling, it's not CGA. It's background paper. Yeah, we will do it. Okay. But turned out it is very complicated because it was difficult to get information, data, and on unpaid and paid care sector. We tried to find out more about care of children under 5 years old, and because from the 6 years they go to school, public school or private school. So that's why we are focused on the child care starting from 0 to 5 years old. And also we try to find out what's the available data sources on elder care, paid and unpaid. And also for people with disabilities, adults and children. That was very hard. It was very, very hard. First two about childcare, it was, when you started digging information about childcare, everybody was happy. Oh, there's some research there, or the data is here. But when you go to that people, children with disabilities, children with, it was very difficult to find the information and data, but we tried hard. Okay, so where is it? Okay, so about Mongolia, I'm very happy that our team became a part of that large research project that will last about 5-6 years from now. And Mongolia is, very, only 3 million people, 3.4 million people, and very small economy, very small economy, about $10 billion US, very poor, and also politically sometimes very sensitive because of sandwich between Russia and China, and all economic life sometimes depends on very, political, diplomatic relationship between these two neighbors, and environmental situation is not so improving from the year to year. We have a lot of difficult cold winters. We call it zot, which means that very cold winter, long winter months, about 5-6 months, for example. So, and Mongolia is also very centralized economy country with 21 provinces and capital city plus. But about half of the population lives in capital city side, including me. I was born in the countryside, but because of my job, I also live in the capital city. So very crowded with very poor infrastructure, and so you can imagine that it's difficult to provide care for the entire population with that kind of very low density in that country. So the economy growth is, you can see in that graph that it was growing well in 2009, 10, 11. But starting from 2012, it started to decline, and then COVID-19 happened, and we were, the economy is still in decline. We don't see future very bright economic growth in the next few years, unless something very unexpected, very nice thing will happen. We don't know. It means that number of the poor people will increase in the country, and the economic and societal inequality will increase. But for now, according to the very latest official estimations, 1/3 of the population live under the poverty line, and the Gini coefficient is about 0.32 or 4, something. Okay, that's the background about the country. So then we started to dig into what kind of data we can find on unpaid care sector in Mongolia. Of course, time use series, the essential one. Luckily, because of the UN and UNDP aid, the National Statistical Office of Mongolia started to conduct time use survey starting from 2007. So now 2007, 2011, 2015, 2019, last one. So next year, the National Statistical Office also going to conduct next time use survey, which is very, very nice, because every 4 years they're going to collect data on time use. So another very good source is the multiple indicator cluster survey. We analyzed this survey, and the National Statistical Office collected this kind of survey 2 times, 2013 and 2018. And it has such huge, rich information about child care, elder care, about very unexpected thing we found from that survey. I was, as an economist, as a researcher, I felt myself that I was overlooking that survey, but it was huge help for us to find out about unpaid care, children, elderly, people with disabilities, huge source. And another very good source of data in Mongolia was labor force survey, which the National Statistical Office has started to collect since 2005. Now it collects every year, which is so nice. And thanks to National Statistical Office policy, that all the survey information, raw data is available to everyone, including you, in English, in Mongolian, on the platform which is called 1212.mm. So free of charge, you just need to register. And myself and my students always use that platform to get to work, to use raw data from the survey. So, for example, we are from the labor force survey, we started to find out how much average weekly time spent on the unpaid care for disabled people, elderly people. It's not from time use survey, it's from labor force survey. We can compare what's the difference between these 2 surveys or something like this. So we can disintegrate this data by gender, age groups, location. That was very good thing for us to find out. And okay, so yeah, so now I will talk about unpaid care. What we found, what kind of data or survey or administrative data is useful to analyze the situation with paid care sector. Paid care sector. I just for children.
Sorry, I'm just trying to get rid of. I'm sorry. I'm just thinking.
Okay. So, very useful data, of course, from administrative data, because it's on paid sector, from the Ministry of Education and Science, and from the National Statistical Office. Data from the National Statistical Office, Mongolia, is very much available. But data from the Ministry of Education and Finance, no, not finance, Education and Science is very difficult to obtain. There is no secret, no state secret in there. But people, ministry people don't publish, every year or every quarter. And sometimes data is pretty much not so, sometimes very biased with measurement error, measurement bias, something. But we using when we started to do this research, we were very confident we can find anything in that. But it turned out it was difficult, and we used our informal connections to get this administrative data, and we came very with clear picture on paid sector on preschool, primary, and secondary education, because we can get enrollment data by age groups, by sex, and location. So the statistical office data was very good, but Ministry of Education and Science data was pretty much rich in terms of disintegrated by the location, by counties, by provinces, by sub-provinces, and by the ownership of the educational enterprises like private, public, or international. So we found very good source on paid care sector for children from the data from Ministry of Education. Another very good source of data for paid care sector for children was household socioeconomic survey that is collected by National Statistical Office every 2 years. And it gave us very nice picture, information on tuition fee that is paid by households, information on paid care, years for household members, nannies or some domestic aid. Third source of data on paid care sector for children was labor force service again, because it gave us information about wages of domestic workers paid by households, and that was very good. We found that it was very rare, but we found from the labor force survey 2020 raw data from there's 13,280 households in the sample, which means about 46 individuals in the entire sample size. But we found only 3.4% of total employed people, if it's nationally represented, sample sizes presenting whole society, then we estimated that 3.4% of all employed people are working in paid, care sector. From respondents' answers, they understood that very few. But we don't think it's true numbers, true pictures. So we need to dig more deeply. So another main data source for childcare, especially for orphan children, was about child money program came from Ministry of Labor and Social Protection of Mongolia. But that data is also administrative data. It's not readily available and very difficult to obtain. There's no state secret, I again saying, but the people from ministry don't give us the number of orphan children by location, by gender, by age. I'm telling that I was telling to the ministry people to get data is I used that argument, the following argument. Our research is about care sector. We just want to estimate, have some, very approximate picture of care sector in this country. Please give us your data, your administrative data. We will not to criticize government, your administrating. We just need to have some estimations, to make some estimations. Then they give us some numbers, but still not full data. So for elder care, we've got data for elderly people from Ministry of Labor and Social Protection. And also it's still very limited, but also another data source is Ministry of Health of Mongolia and National Statistic Office. Somehow we didn't expect it, but the paid care for elder people in Mongolia turned out huge paid sector. Using taxpayers' money, government, in the name of the Ministry of Labor and Social Protection, spends a lot of money on older generation, older people, in forms of pension. I will show you in the next slide how much they pay. So another source was the census data, because that data collected information on age, ethnicity, birthplace, migration, education, marital, and labor status, and also individuals' view of the ruling situation. That was very important, very good source of data for elderly people. From the census data, we learned more about how many people migrate, how many people live with their children, daughters or sons, family, many other things. Also, household socioeconomic surveys also gives rich information on paid care for household member, or child care, or care for disabled person in that household. And also we collected more what's the policy and legal framework aimed to develop care policy in the country for each category: child care, elder care, for people with disability. So it turned out we had so many laws and government resolutions and national programs that is aimed to provide good care, high quality care, very affordable and care. But as a researcher, I would say that after reading or collecting all this legal frameworks, government resolutions, ministry resolutions. All of these nice things stay only on the papers, not implemented in the real life, reaching everyone, every person who needs inner care, but not so nice picture. But I hope that after our research, after our project is done, maybe a very good, positive improvement will be done in this sector. So, for example, unpaid care sector, data on paid care sector from the Ministry of Labor and Social Protection, pensions, unemployment benefits, health insurance. For example, the state is responsible for health insurance for every children until the 18 years old, for all people who are over 60 years old in Mongolia, also for all people who have disability. So the country, the government has huge burden of paying health insurance and social insurance for all these people. Other social insurance like maternity, disability insurance, social assistance for elderly population, child protection, family allowance, welfare and social service that is aimed to help sick, the poor, other vulnerable groups, like including small ethnic minority who lives in the north side of the country. We call them Sato. So kind of we have huge programs, but payment, social insurance and social assistance is not so much money, about $10 or $20 each month. But it has in the practice, we are having it, which is good thing. But because the economy is so poor, not growing so fast, the amount of the social assistance is not getting bigger, which means that these people are not getting out from the poverty, very vulnerable situations. So we have also cash in kind transfers, like food stamps that is targeted to poor people. So labor market programs. But this program is usually not targeted from people about whom we are talking here. So data on paid care sector for disabled individuals comes from the Ministry of Health, National Statistical Office, and also from census data, and also labor force survey, and also from the Ministry of Labor and Social Protection of Mongolia. We learned a lot from this administrative data and also survey data. It was very, very sad to know for me as a researcher that in Mongolia, not many people have done research to understand these groups, to help them to develop the very appropriate policy, governmental and central government and provincial government level. That was very sad. So what we found is that about unpaid caregivers, of course, main caregivers are family members and people, adults, of course, who are in the labor force or who are not in the labor force, mainly women and girls. Also, we found the children in the household, in elderly household members are huge, the force of giving, unpaid care for other members of the household. We found that urban Mongolians spend more time on unpaid work than rural Mongolians. So time spending, we compared that time use survey from 2011 with 2019, And we found that the time that's spent by people in household on that just household work is decreasing since 2011, but time they are spending on unpaid care is increasing, has increased from 2011 level to compared to 2019 survey, which means that the demand for unpaid care and also paid care work is increasing in Mongolia. And also we found that from Mongolian Time Survey 2019 that about 2,533 individuals have reported directly that they're caregivers. And from them, we estimated that 70% of them were women and the remaining the 30% men. These people cared, 71% of them cared for children, 61% cared for elderly, 69% of these people cared for disabled family members, and 68% for other family members, which is double, giving double care, working, giving care for children and elderly, grandparents, and other family members. So, number of individuals who are engaged in care work for children, elderly people, and disabled people were, from this kind of survey found increasing 71%, 61%, 69%, 68%. So there is growing demand for care work among the population. Who gives them? The family members. Also, children are also one of the main caregivers. For example, children aged 12 to 17 are care workers in their respective families. They spend about half an hour per day for elder enough for their grandparents or disabled family members, about also half an hour in other family members we found. So children are also working in unpaid care work sector in Mongolia. So we now I will talk about unpaid care work for the children under 5 years old. According to law of preschool education law and general education law, Mongolia, kindergarten, the enrollment age for kindergarten is 2 years. So children under 2 years are cared in their families by their family members, grandparents or mothers or fathers or their siblings. So that's why we divided these children under 5 years old into two groups, from 0 to 1 and from 2 to 5 years. So almost all of the children under 2 years old are cared by their parents in their family. But very few from the time of survey, we found that they go to paid children's care centers. Very few. Also, we found that for this age group children, there's some paid care sector is existing. For example, NGOs, community NGOs, private organizations, and sometimes public organizations, public children's centers. So, percentage of children under 5 years is about 13.7%. in compared to total population, which means it's growing. And by our estimations, this country, Mongolia, needs to take care of about 450,000 children under 5 years old, under the age of 5 years old, each year. So there's huge demand for child care in this country. How about elder care, unpaid care? As any other countries in the world, older persons usually live with their families, like Mongolia. Generally, by culture or by traditions, older person are usually all the son is responsible for their parents, which means that wife of that oldest son or daughters of that oldest son usually take care of their parents-in-law, and other female family members. So traditionally, Mongolian parents prefer to stay with their family, not to go to institutions outside of the family. So, but I do think like a Korean case that this pattern will change very soon in Mongolia because size of the family is getting smaller now, smaller. For example, my grandmother had 8 children, and my father had 2 children. Luckily, I had 2 children, but my daughter doesn't want to have a child. I'm not grandma yet. I'm hoping that I will be grandma after my son decides to marry. For example, just in my case, family size is getting smaller, so there will be not sufficient number of family members who will willing to take care of their parents, old parents. So very soon, Mongolians prefer to choose some other institutions, like older, centers, care centers, maybe. So when we started to this background paper, we were very sure that we can find anything about this sector. We were very kind of confident, but we didn't find anything. Not so much information on daycare viewers, but older care, trained community-based service providers. We didn't find any information on that. Maybe we don't have that, but we need to work more to learn more. So there's very few research literature on child care, elderly care, and care for the people with disabilities. Very few scholarly articles that is published in the economics or sociology journals. I found only Mary's Flores article with her Mungo, and also Sun's Korean paper on that, where she compared with Kenya, Korea, not Kenya, Ghana, Korea, and Mongolia. Only these 2 articles, but we found very nice, good reports like this. Like this. Where is it? This one. Research-related literature, disability. It was very useful. So, let's talk about elder care. So, percentage of the elderly people compared to the total population is getting larger. Now it's 10%. 10%. 2007 it was 7%. 7.3%. So the population is getting more aging, you know. So, for example, compared to total population is about, as Jim told us, 1.8%. But growth rate for elderly population is about 6% annually, 6%. So there's huge demand growing for the elder care. So we estimated how much time is spent for elderly people by gender, occupation. Also, the number of the old people who live alone is increasing. So there is huge demand also elder care, outside of the families. So how about unpaid care for the people with disabilities? That is very difficult to find. But from that service, we found how much time is spending to take care of the unpaid care for individuals, for the disabled people, by caregivers, gender, location. Seems like a woman, especially rural women, spend more time on care for people with disabilities. We need to find out why rural women spend more time. Maybe there is insufficient facilities. Maybe there is, more people are injured, or have more people with disabilities prefer to live in rural area. Maybe we need to find out. So we just find out. Even that number of people with disabilities in Mongolia was very hard to find because it's administrative data. It's not coming from the survey. Somehow we found, and in total about 100,000 people. For some countries, number maybe seems like very small. 100,000 people. It's very few. But can you imagine 3.4 million people in 100,000 people with disabilities are not receiving any sufficient high quality care, which means that quality of life, their quality of life, their satisfaction with life, their family members' life will be, in very poor situation. So we need to find out, we need to develop some good policy proposals, policy mechanisms or tools to improve the situation of these people. So this is just what we found using the labor force survey data from before COVID and during COVID. We were interested how much that unpaid care for disabled and older people have changed before COVID area, during the COVID year. So we were expecting that women are taking a lot of burden of the unpaid care of their respective families. For example, this is the, where is it? My mouse is now here. So females, of course, spend more time. But can you see that in the 2020, during the COVID year? So kind of declined, in first quarter, second quarter, compared to previous year, the same quarters, it declined. We were very intrigued. We were very surprised. Wow, we were, after reading a lot of research literature on COVID-19 situation with unpaid care work, we were expecting, wow, that kind of, must be increased a lot. But in fact, it had declined. So it was very interesting. So we will work more to find out why. Maybe other family members stay at home, maybe fathers and husbands, or school-age children maybe have with their mothers to take care for disabled family members or old grandparents, for example. So we found very interesting numbers on unpaid care for disabled people in childcare. So we also collected what's the institutional context, what's the state regulations about care, paid care for the individuals with disabilities. So we found that there's two very large laws were adopted, and the national program to support the persons with disabilities was implemented. And but at the end, they were distributing money, like about in the US dollars, about $59. But at that time's exchange rate, that monthly benefit that pays by taxpayers' money from the state to the people with disabilities every month, about $59. And also parents who cannot work in the official labor market because of the sick child or a sick child with disabilities, that parents are allowed to receive monthly benefit of $29 each month. It's not so much money, but it gives to every parent who will apply for that program, which is good. So after the implementation of all this social assistance and the laws and national program, but we didn't find very good, satisfying evidence that is implemented. It reached everyone in the rural area. We didn't find any information about some, service available for the parents, for parents, how to work with, evolve with this children, their children with disabilities, how to send care center, how to educate them. Okay. Yeah. I know. So we found on paid care sector for children about the kindergarten. You will find very nice fact here. Paid care sector, for example, for preschool aged children, state public kindergartens, number of public kindergartens are on the rise, increasing. Also, as well as private kindergartens, which is a very nice thing about kindergartens in Mongolia compared to the Korean situation is that kindergarten opens at 8 a.m. and closes at 6 p.m. 6 p.m. It's an early childhood education center combined with child care center. So it works from Monday to Friday, and from 1st of September until the 1st of June, all the summertime don't work. So it's huge assistance, huge paid care sector for the children. So we also find this child money paid care sector. That was we need to work on more to find out more information on paid care sector for children. Children's, private care center, privately operated or operated by NGOs or by some charity or some religious organizations. Paid care sector. So government financing for elderly care. We found all these numbers, all this money, how much it's spending from the budget every year. So in conclusion, I would say that even we found a lot of information, a lot of numbers on paid care sector, there's still insufficient data on information on domestic workers, nannies, caregivers in Mongolia. For example, Household Socioeconomic Survey 2019 revealed us only 8 households where it had reported that they paid for nannies, very few. Also, data on unpaid paid care for children under 5 years old in Gir area, peri-urban and poor districts of the UB cities, not so available, and also in countryside. And also data on paid care for people with disabilities, including children with disabilities in general, very hard to obtain. We need to also work more to find more data for more information on that. And, data from ministries are very difficult, was very difficult to obtain and do some research. Next steps, what we are planning to do is we need to secure funding in our research fund for our next steps of our research. And also start to research on paid care sector very carefully, digging more, and also to begin qualitative research to find out why this paid care sector for elderly or children with disabilities is not growing, not provided by the private sector. What's going on? We need to conduct more interviews with this people who are responsible, who are knowing, operating this sector. And also our goal is for next year is that kind of came up with the size of the care sector in Mongolia, and able to say, oh, this percentage, like Sri Lankan team said, it's about this size of the GDP's the care sector is about 10% of GDP size is raising in something. So we wanted to estimate that. In the future, in the third year, maybe we will do macro level CGE modeling. And final goal of our research, of course, and after all this research, we really want to develop policy recommendations to policymakers in Mongolia to make the care sector more affordable to everyone, and also make it more dignified, to caregivers and care receivers also, and also to make this sector more sustainable, not to make a burden for the taxpayers. Maybe to every members of society needs to contribute and receive as he or she needs from that sector. Kind of really want to do that. That's why we are involved in this research. Okay, thank you. I took so much time.